So we just got a notice that we're being live streamed on YouTube.
Mm-hmm.
Good afternoon, everybody.
Good afternoon.
It is great to see all of you. Thank you for joining me for our weekly chat, or our community chat today. I'm glad everyone got the message, or at least all of you got the message that we're meeting on Zoom and we're not meeting in the GRA as we typically do. We'll give it another minute or so before we get into the good stuff. Looks like there might be a few more people working on logging in now. And as the attorneys want me to always say, you're being recorded. You're being recorded so that you're being shown through TLG TV. Hopefully you're being shown through TLG TV. So those of you that are here on the Zoom, welcome. Thanks for being here. Those that are joining through your televisions, welcome. We're glad you're here as well. Yeah, so thanks everyone for your flexibility. The reason we're meeting, in case anyone didn't know, the reason we're meeting on Zoom instead of in the GRA is because we have our flu shot clinic today in the GRA. So we had a team from Safeway Pharmacy come in first thing this morning and administering flu shots for our residential living residents. And they'll be in there through, I think, 3 or 3:30 today. So we're glad that today in the GRA. So we had a team from Safeway Pharmacy come in first thing this morning. I think there was a request to sign up in advance, but if you didn't sign up and you still would like to get a flu shot, I think you can do so by going down to the GRA sometime between now and I think 3. There have been some questions about flu shots for Kaiser residents with Kaiser insurance. Kaiser, it's a little more complicated for those with Kaiser insurance. Charmaine Verdor, our Director of Wellness and Assisted Living, she is working with the team from Kaiser to make arrangements for residents with Kaiser insurance to be able to get their flu shots. Nothing is finalized yet, as far as I know, but stay tuned for more information. Once we have more, once there's a definitive plan for residents with Kaiser, we'll make sure that's communicated as quickly as possible. And if you can, and I know several residents probably have gotten their flu shots already through Kaiser, please do so. For anyone who can't, like I said, we're working on some alternative arrangements. On the subject of vaccinations, we are confirmed for an updated COVID booster clinic here at the community next week. It is going to be on Friday, next Friday, which we know unfortunately conflicts with an outing, and there are going to be several residents that are going on an outing next Friday. Unfortunately, that was the really the only date available anytime in the next few weeks that the pharmacy was available to do the COVID booster clinic. So it's going to be on Friday the 30th. And I believe it's going to go from 8:30 a.m. to 3:30 p.m. We'll have more concrete details in the weekly updates tomorrow. But again, it's a COVID booster clinic next Friday. Now, one thing that's important to note is, as of now, we're only confirmed to have the Pfizer booster available. I know there's an updated Pfizer and there's also an updated Moderna booster, but the only one that the pharmacy was able to secure definitively for next week is the Pfizer booster. Any questions on flu shots or COVID shots?
Yeah,
I have a question about the flu shot.
All right, go ahead, Judy.
Is today the only day it's going to be offered?
Today is, well, technically no. They're gonna be back again tomorrow. And today was the day that dedicated to residential living residents. They will be here tomorrow. They're going to be in the Redwood room tomorrow. And they're going to be doing the flu shots for assisted living residents as well as at memory support residents. If you go by the Redwood room tomorrow while they're here, I'm sure they're likely be able to slide a few people in if need be. So I hope that answers the question. Let's go to Paul Barish and then over to Sharon Roth.
Bradley, regarding the COVID booster on Friday the 30th, is that the same day the staff and other populations besides independent living are all going to get the booster?
A good question. At this point, it is, I believe it's going to be just for residents on that day. Ms. Roth.
Yes, is Kaiser going to approve the COVID booster, or is it still in the works?
I believe that the COVID booster, I'll find out for sure, and I'll have that included in the weekly updates tomorrow. But
Okay.
my understanding is for the COVID booster, it will be open to anybody regardless of insurance coverage. But I will, I'll confirm that and make sure that that is included in the weekly updates tomorrow.
Good, thank you.
You're
Brad?
welcome.
yeah, somehow I can't raise my hand.
Go ahead, Mr. Strain.
Yeah. Could you possibly arrange for I think it's 18 to 20 people who are going on that expedition? If they're here at 8:30, you could do those people between 8:30 and 9, presumably. Be a little bit of a rush with this 15-minute wait, but
Yes, what we're going to reach out to the pharmacy to see. I don't think they can get started earlier, but we want to try to make sure that they're here ready to go, ready to start sticking people at 8:30. And so if that's the case, yeah, they'll probably be able to get people in right away. For residents that are going on that outing and you want to get it before you go, we'll have signups available through TLG Connect. So I'd say sign up for the first available slots, and then once you're there, I'll be there and a few other team members helping sort of get people signed in, and we'll try to get those that are going on the outing in ahead of everyone else so that you can hit the road. But yeah, I can't guarantee that we'll be able to get everybody through and out, but we'll do our best to make it work for everybody.
Bradley, this is Susan.
Yep.
There's also, as I recall, a 15-minute wait after you get the shot.
Yep.
You have to sit and wait to make sure you don't have a reaction.
Get as many people
Bradley,
through right at 8:30 as possible, and we're gonna put as much pressure on the pharmacy to make sure that they are ready to go right at 8:30 as well. In the past, in the previous clinics, it's taken a little bit of time for them to get moving, but we're going to do all that we can to avoid that.
Okay, Bradley, it's not clear to me whether you're saying that we're waiving the 15-minute wait or not.
I'm sorry, can you say that one more time?
Yes, it's not clear from what you're saying whether or not you're waiving the 15-minute wait that's usually required.
Oh,
if
if
people
we're
have to be on the bus at 9 o'clock, then they have to get their shots before 8:45.
yeah. How do I say this? Technically, no, we are not waiving the 15-minute waiting period. But we will also not be strictly enforcing a 15-minute waiting period. We will be informing residents that they should wait for 15 minutes after their shots. And yeah. So is that a vague and ambiguous enough answer?
Is Victor going to have an EpiPen?
We will not have, well.
Never mind.
All right. Any other COVID booster or flu shot related questions before we move on? All right, well, next, so we have, I think I mentioned this maybe at the last time, but we have just completed our team member experience surveys. So this is the team member equivalent of the resident satisfaction surveys. And we just closed a 2-week window or 10-day window for team members to complete their surveys. And I am, so we had a goal, a target, really our target was 75% participation. So 75% of all of our team members, and this includes full-time team members, part-time team members, on-call team members, some that we see every day and some that we rarely ever see. We had a target of 75% participation, and the deadline for completing the surveys was 11:59 p.m. last night. When I left yesterday afternoon at about the last time I checked, it was about 4:45. We were at like 71%, and I'm pleased to report that by 11:59 p.m. we were up to 77.8%. So we met our goal of participation for our team member, what we're calling our team member experience or team member engagement surveys. And I'm actually really excited about this surveys. We actually haven't had structured community-wide or organization-wide team member surveys for a couple of years, because it was just another burden that we didn't want to put on our team members, and we kind of had this difficult decision where we wanted to make sure our team members had opportunities to share feedback going through the challenging the last couple of years, but having a formal structured survey, we sort of made the decision that would be too burdensome, and it'd become a burden in more of a benefit for our team members. So I'm excited that we got this one done, and we're going to be presenting to our team members as sort of a summary within the next few weeks of the results. And then our leadership team, in collaboration with all of our team members, are going to be working on some action planning. I'm really excited because it's going to give us a great sort of framework for us to work on our team member experience over the course of the next year. Just out of curiosity, for those that are here on the Zoom, would it be of interest for residents to see a sort of a summary of the team member survey results?
Yes.
Yes. Okay. All right. Well, we'll work on a summary that we can present to the residents as well. On the subject of surveys, resident satisfaction surveys will be starting next month. We are tentatively scheduled for a kickoff event on October 17th. And for those of you that recall or that were here last year, when we did the Best Senior Living survey for US News, it's going to be a similar process to that. So next, again, I think we're tentatively scheduled for October 17th, which is the kickoff of the survey window. And then I believe it's a 2-week window, October 17th through October 31st, where the surveys will be available to be completed online. So that is something to look forward to, an opportunity to either share wonderful feedback or to voice your frustrations and concerns. We want to hear everything. We want to hear what we're doing well. We want to hear what we need to improve. There have been some questions, and it came up, I think, at the last resident council meeting about. So we're partnered with an outside group that's helping facilitate the surveys. And basically what we're doing is we're combining our efforts. So we're doing through the survey that will be offered the second half of October. It will be both the sort of traditional resident satisfaction surveys as well as the Best Senior Living survey. And so there have been some questions like, okay, and I'm not gonna, I apologize if I'm not relaying this in the best way, but okay, are we looking to, is the goal of this to make sure that the Terraces of Los Gatos is included in the list of best senior living communities in US News and World Report? Or is the purpose of this survey to give honest and meaningful and thoughtful feedback that includes, the constructive, critical feedback? And yes, the goal is both of those things, which I understand can create maybe sort of a little bit of a push and pull or imbalance. What I would say is what's most important in terms of feedback is, at least for me, what I have found to be most impactful and helpful is the narrative feedback. So there's a lot of rate 1 through 10 or rate 1 through 5. I don't remember what the scale is. But then after every question, or not, maybe not after every question, but after many of the questions, there's a spot to provide narrative feedback. And I would say definitely take advantage of those windows to be able to give feedback. I don't know if that makes any sense or not, but does anyone have any questions regarding the survey process at this time? Mr. Barish.
Bradley, you mentioned after the employee team member survey, there's going to be an action plan and you're going to share the highlights. For the resident survey, again, acknowledging the part that helps put the best foot forward for U.S. News and World Report or marketing. How about an action plan and a survey response from residents about things that turn out to be change motivators for you? That feedback will, I think, stimulate more participation and give residents a good chance to see how their narrative comments get responded to.
Yes, thank you for that comment and suggestion. What we're planning to do is, I'm hoping to use the first week in December State of Business meeting to provide a summary of the survey results to the residents for the residents satisfaction surveys. At that point, we won't have the action plans in place yet, but likely after the first of the year, then we'll present our kind of an overview of our action plans based on those surveys. So that's definitely going to be the most important part, or one of the most important parts of the process. What I don't know definitively yet is what the turnaround time will be on all of the data. It's a different system that we're using for our team member surveys than the resident satisfaction surveys. The team member survey data, we're able to access it in real time. So I have access to all of the results now from the survey window that closed yesterday. But I don't know how quickly we'll get those results for the resident satisfaction surveys. If we get them in time, like I said, the goal is to present an overview in December. But if it takes longer to get that back, we may need to push that timeline back a little bit. Any other survey related questions before we move on? All right. Couple of things to a couple of events or activities are coming up in the next few weeks that I wanted to mention. We're really excited that we're going to be having another trip out to the car collection of Larry Carter as a fundraiser for the Foundation Benevolence Fund. We are scheduled for that exciting event on October 25th. There's going to be some details in the weekly updates tomorrow, and then some more details in the next week or two on how to sign up and when to sign up for that. It's going to be a really great outing. We did it, I know, it's probably 4 or 5 years ago now. And it was a great success, and a lot of residents really expressed a lot of interest in doing another event out to see the beautiful car collection. So stay tuned for more information coming in the next few days. Judy, is there anything else specifically that you wanted to mention now about that?
Did you mention that he has 70 cars on exhibit? And he
I did-
actually does apparently doesn't let you just roam around. He actually guides you through the exhibit and talks about the cars. I hear it's really fabulous. I'm really looking forward to it. And then I believe we're going to maybe have a little reception in the afternoon afterward.
Yes, thank you, Judy. I didn't mention those things, so thank you. Just out of curiosity, is there anyone here that went on that trip, whenever it was, 4 or 5 years ago? Oh, great. Perfect. All right. So
Are you
that's
going to
coming
go
up.
again?
Yeah, definitely go again. And I think it's going to be two groups, so 2 busloads. I think one's going to be starting at 10 o'clock and one at 1 o'clock. A couple of other things to note. There is an upcoming event presentation next week. And it's going to be a really good event. And I'm really looking forward to it. It's called Be Sensitive, Be Brave, Suicide Prevention. And I know that when we say things like suicide and suicide prevention, it may create some uncomfortable feelings, and rightfully so, understandably so. We have 2 presenters that are going to be coming in from the Santa Clara County Suicide Prevention Program. And this is a presentation that they do in all sorts of places, in workplaces, in living communities, and it's a presentation that I think everybody can benefit from. And I want to make it clear that it is not for people that are considering suicide. It's not that. Hopefully, if there are that residents or team members that that is a concern for them, we would absolutely hope and encourage them to attend, but others as well, because they'll give us tools to help have conversations with people that we're concerned about, help be supportive of others. And also, we want to have make conversations about difficult things more comfortable. And so even if, I don't have anyone that I know of who is suicidal, I don't know anyone, I'm not suicidal, I don't think I'm ever going to know anybody who is suicidal. We want you to come. We want everybody to come, because when those opportunities come up and either you as an individual need support or you have the opportunity to provide support for another person, we want to do all that we can to provide you with the tools and the resources and the confidence to be able to be supportive and have the support that you need, or provide the support that others may need. So I would encourage everybody that is available to come and join that event. It's going to be on September 27th. So that's, I don't know what day of the week that is. Tuesday. And I don't have the exact time in front of me, actually. But the information is up on TLG Connect.
I think it's at 2:30.
Oh, thank you very much. So 2:30 next Tuesday. There'll be some more information up on TLG Connect and also in the weekly updates tomorrow. They asked that the participants complete sort of a questionnaire, kind of a worksheet in advance. So we'll make that available and encourage attendees to complete that in advance. But if you don't, we won't turn you away at the door. So please still come. Mr. Barish.
A brief case study about suicide prevention for people on this circuit. Our oldest son was in his second year of high school. A classmate of his parents decided that they needed to divorce. And they asked the young man which parent he wanted to live with. He took his own life. And the school organized afterwards a function for students called peer counseling. Not that the students were going to be able to respond with counseling to the intended, but that sensitized the students to know where to get help if somebody was in that circumstance. And I hope the terraces will follow, or these presenters will follow that model, and that the terraces will have an identified team member who can be the point of contact if another resident understands that someone is in that category.
Thank you so much for sharing that. And yeah, we will definitely be providing resources and information about who to contact and who to reach out to should those situations arise. Ms. Sampson.
Has anybody here at the terraces or at corporate level thought about adding elder care and mental health trained social workers to the communities? Because I think that would provide real value. And if you've got communities close together, perhaps they could share a social worker, but I think it's an unmet need here and other places too.
Yeah, that's a very good question, and that's something that we are sort of actively evaluating from our. So there's a few things I can share about that. I think having a licensed social worker here at the community as a resource could be an incredibly valuable addition to the community. If, and this is an increasingly larger if the right person is available to fill that role. There's some communities that have licensed social workers, and some do and some don't. We don't, and for as far as I'm aware, I don't know if we ever have here at the community. I think it could be a really huge benefit. Like I said, if it's the right person. If it's not the right person, it could actually sort of really be problematic, as I know it has been in other communities, not necessarily in the organization, but you have to have the right person. Unfortunately, we hear a lot about shortages of nurses. If the shortage of social workers is even greater. There's a huge demand for mental health workers in general, but specifically social workers. And the supply is smaller than it ever has been, from what I understand. But that is something that we are exploring. There's also another sort of related opportunity that we are exploring right now. We're in conversations with a group that it is a group of mental health professionals, mostly psychologists, that provide services specifically for senior living and senior healthcare facilities. There's a psychologist that works with that group that provides a limited amount of services to residents in the health center. But their caseload is incredibly large, and what they provide here at the Terraces is a very small percentage of their time. But we're working with their group as they are actively trying to recruit and bring on board an additional psychologist that would be available specifically for independent living, assisted living, and independent and assisted living, and potentially health center residents as well here at the Terraces. They are, like I said, they're going through the recruitment process right now to try to find the right person to fill that role. They wouldn't be dedicated specifically, or they wouldn't be dedicated only to the Terraces of Los Gatos, but that would be a part of their caseload. There's somebody that it sounds like they're close to hopefully making an agreement with. And at that point in time, then we would start working on communication out to the community about what services are available through them. The good news about it being a psychologist is that most of the services would be billable to insurance, and so there wouldn't be much or any out-of-pocket expenses either for the residents or the community. So that's looking like it's going to probably be sooner than the possibility of having a social worker on staff. But those are two avenues we're currently exploring to meet that need.
One would hope that if there is somebody in crisis, that they don't get the response, well, we can have somebody see you, or the psychologist can see you in 4 weeks. So part of what we need to focus on with them is quick availability if we have somebody in crisis.
Yes, for sure. Okay. All right, moving on. Just a reminder, Paul Macri, Director of Dining Services, he is away on a previously scheduled vacation. He's been out this week, and he'll be out next week and back the following week. So when we hired him, we knew that this was coming up. And we thought about, okay, well, maybe do we just have him start after his vacation? But we said, no, let's get him started as quickly as we can. And then with an understanding that he'll be out on vacation for a few weeks. So if anyone hasn't seen Paul and you're wondering, oh gosh, where did he go? We just hired somebody, now he's gone. He's just on vacation, and he'll be back in another week.
Okay. It's unfortunate that Sherry's vacation or time away is scheduled during the same period.
Yes, you're right. It was unfortunate. Joan is here in the interim, and Sherry will be back next week, and then Paul will be back the following week. So thank you for your patience, as they're both having some time away. And I don't know, I know he hasn't been here for too long, but hopefully several of you have had the opportunity to meet Paul and interact with him. I know he's eager to meet all of the residents that he has not met yet. And on that note, I'm pleased to announce that we have a new executive chef who is scheduled to join our team on October 3rd. So in, what's that, 10 days, 12 days? We will have more details about the new executive chef next week. Waiting to get some more specific details before we release it out to the community. But excited to have our new executive chef come on board. And after that, we will have a complete dining services leadership team. That is all I have on my list. So what else would you like to talk about? What else is on your mind? What questions do you have? Linda?
At what point are we going to be able to return to having guests for lunch in the dining room?
Good question. We don't have a definitive date, but we are sort of loosely targeting the 1st of October. So some of you may recall last year around this time, school's back in session and COVID numbers started spiking. We wanted to see what happened in the first, throughout September. Fortunately, it seems like we're not seeing the same type of spike we saw last year. We anticipate probably the first week in October, but I would anticipate by the end of next week we'll have a definitive date set to communicate out to the residents. Good question. And back to you, Linda.
I would like some help in understanding the COVID policy up in the health center. I know you have some new cases up there, and I know we were up there with the bookmobile on Monday, and they interrupted our routine service to say, no, we've got COVID up here, you can't come up here anymore. And yet the health center is not closed. Visitors are up there all the time, and residents are up there visiting with friends.
Mm-hmm.
So I don't understand why the bookmobile is different.
That's
We
a
are
good
vaccinated, we are masked.
That's a good question, and I don't know if I have an answer for you.
If you could get some clarification that we all could understand about what it is, what the rules are for the health center, so that they're clear for all of us.
Well, I can share what I do know and then get further clarification. Right now, group activities and events and communal dining in the health center is closed.
Mhm.
Visitors, we're still open for visitors, and actually there's been some changes in some of the guidelines coming down from the state and federal regulatory agencies that visitor restrictions, basically we can't restrict visitors even when there are significant outbreaks. There's some additional precautions that we need to put in place, but there aren't any circumstances that would allow us to say no visitors at all. And so I think, so the idea is, because visitors are still permitted, the the guidelines are that visitors come and they go directly to the room where they're visiting with a resident, and then they leave. And so the concern may be with the bookmobile, if they're going to multiple residents' rooms in the health center, that may be where the concern is. If it were, we're going to one resident's room and then leaving, that would be fine. But I'll get some clarification and follow up.
Okay, because I've gone up to the health center, not with the bookmobile, but go and see people in various rooms. In the same visit, and nobody has ever said anything to me, so it would be good just to have clarity.
Okay. We will get some clarity. Thank you for that question.
Bradley,
Yes, ma'am.
what, if anything, is being done about getting generators for the elevators in the residential buildings?
We are trying to figure out a way to get the elevators on generators out in residential living. What we have done is we've upgraded the battery backup system on the elevators in residential living. But what that does is just ensures that residents are able to get down to the bottom floor, they get down to the ground floor and the doors open in the event that there's a power outage. Getting the elevators on a backup generator system is incredibly challenging and to be frank, incredibly expensive. And so we haven't given up the hope that there is a way to make it work, but we don't have a solution at this point. But it is something that we are trying to find a solution for, but we haven't found it yet.
Well, it's very worrisome because we have so many people on the second and third floors who are not ambulatory themselves without a walker or a wheelchair. Evacuation would be very difficult. And we do have generators in the main building. Why can't we have them in residential?
Yeah. I mean, it's certainly a very valid concern. We're also exploring options for alternate forms of sort of emergency evacuation for those on the second and third floor that wouldn't be able to get down the stairs. But that wouldn't necessarily help when the power's out and people need to go down to the dining room for dinner. So frankly, we don't have a solution at this point, but it is something that is on our radar that we're trying to find some solutions for.
Thank you.
You're welcome.
This is an issue that is not just here at this community, it's an issue at many communities who are in very much the same boat. And I would think from a corporate point of view and risk management point of view, and we seem to be very concerned about risk management in some areas, and I would think this would be fairly high on their radar. It only takes one event.
Yeah, you're absolutely right. And it's a complex issue. And there's a few different sort of schools of thought or ways of looking at the situation. There's one perspective, and I don't necessarily agree with this perspective, but I think there's some validity to it that says, okay, based on the resident contract, right? If you live in independent living, you have to have the ability to evacuate from your apartment, which we all know in reality, that, you know, it's just not a reality.
Yeah, why does marketing have us sign those contracts and then assign people who obviously cannot evacuate from the higher levels up higher floors to the third floors and the second floors? I mean,
Sure. Yeah,
it's
yes,
crazy.
you're right. You know, and also the reality is, like, you know, lots of residents that are completely independent, but can do absolutely everything except, you know, hike up 3 flights of stairs. You know, we're not going to tell every single one of those residents, all right, like, you got to move. So it is a complex issue. We need to find a solution.
Is corporate involved in this solution?
Yes.
Or are we all on our own?
No, there's definitely involvement with on the corporate level of trying to find solutions.
Is there a timeline?
Nope.
Why not?
It's a great question.
I'd
And
like to know the answer. When,
I will work on a timeline.
thank you. I mean, it's not a Bradley's timeline. It's a, what is the timeline for human good, having, you know, proposing a solution and getting it implemented.
Yeah.
We're going to be meeting with Dan Okus, and I'm asking him the same question.
Sorry, just jotting some notes down. Okay. What else?
Yeah.
What else is on your mind? Anything, any feedback, questions, anything fun, any announcements anyone wants to make?
No,
Any new grandbabies or anything like that?
no.
New pets?
I've got one if anybody wants it.
What was that?
So please let people know. I call her the cat from hell, so, you know, be careful what you ask for.
Oh, you have a pet that you'd like to get rid of? Is that what you're saying?
No, actually not.
I have a 2.5-year-old that I don't want to get rid of, but if anyone would like to borrow him for a couple of nights.
Well, only if you take the cat in exchange. The cat bites, by the way. But then so do 2-year-olds.
Ms. Lusk, go ahead.
Yes, I'd like to remind everyone that the art wall now has a new display, and it really is beautiful, and it shows so many of the talents that we have here at the terraces. It's quilting and crewel and cross stitching and knitting, and it really is beautiful. We are trying now to get information out so that people will know about it. But if you really have any time at all, walk around the corner after going to dinner or before going to dinner and look at the art wall in the hall that you go down to either go to maintenance or the beauty shop or whatever. It really is worth your time. That's it.
Thank you for that. Thank you for that plug, and also thank you for all the work that you and the decor committee do to keep that art wall interesting and fresh, and highlighting the many talents of our community. There is we have started publishing on TLG Connect, and some of you have seen a question of the day, and I think they get published around like 3 o'clock or something in the afternoon. And so every day they publish a question, and some of them I think are kind of silly, and some of them are kind of fun, and some of them are kind of thought provoking. But it's been fun reading some of the responses. So I'm gonna plug the question of the day on TLG Connect every afternoon around 3 o'clock. So take a look, and if you're interested in sharing your answers to the question of the day, you just leave them in the comments, and just as a way to interact with each other and get to know each other a little bit better. Mr. Barish, go ahead.
Are you open to suggestions for the question of the day to engage with residents from a resident's point of view?
Yes.
Okay, well, I have been trying to maintain an unofficial count of veterans and veterans' surviving spouses for the time I've been here in the terraces. The terraces has a question on the entry form asking about veteran status, but there's no apparent motivation for that question to be answered. And Veterans Day is coming up, and the definition of what is a veteran is someone who's done something for the rest of the population in a structured way in government service. And there are other add-ons to the definition, but what do you do with the answers to the question of the day? Is anybody keeping track, or are they just throwaway questions? And I'll be quiet and listen for the response.
Good question. And I'll take the second part first. What is done with the question of the answers from the question of the day? Nothing. It's just sort of at this point just kind of a fun thing to generate some conversation amongst residents and team members. At some point, perhaps it would make sense to do it in some sort of a more systematic way. But that's not what we're doing right now. If there are specific questions and that you'd like to have included as a question of the day, I would say the best thing to do would be within TLG Connect, submit it as a suggestion. I think there's the suggestions cube,
Yeah.
and then we can get it added to the queue for question of the day. And on a similar note, we're going to at some point, and I don't know when, but we're going to be putting out some information and encouraging residents to add more information into their individual profiles within TLG Connect about some of their interests and their backgrounds. And we're going to be encouraging existing residents to do that, and we're going to be working with our incoming residents to do that as well. I'm not totally sure, but I will look to see if veteran is a category or an option that's available within the profiles in TLG Connect. So that may also be another avenue to gather that information.
But Bradley, what happens already with the existing questions that are on the forms people fill out? What happens with those questions? Not the question of the day.
With the questions, sorry, I'm confused now.
On the entry forms, are you a veteran?
Oh, that's a good question. And to be honest, I don't actually know. But I'll find that out as well.
Thank you.
Well, that's a very fruitful topic, because one of the questions on the entry form is about health. And that gets updated supposedly. There's an additional questionnaire. There's another question about financial capability. And as far as I know, that's never updated. Only indication would be if someone is appealing for aid from the foundation that their resource base is no longer adequate. But with regard to veterans, just one data point, Bradley, the unofficial survey I have shows there's about 40 veterans here and a similar number of surviving spouses. Going back to the foundation support, some of those folks that are here unknowingly might be eligible for help from government programs. But if you don't know that they're a veteran and the foundation doesn't know if they're a veteran, then and they don't know, then the foundation is the safety net. So all of that ties together, plus recognition for the past service of both the veterans and their spouses.
Thank you for that. And I'm going to do a little digging to make sure we have, a good system in place for being aware of our veterans and also making sure that we're providing information and resources that may be available to them. So myself, or I may have someone reach out to you, Mr. Barish, with to get some more information.
And you might want to be aware too that there are 3 or 4 veterans on the team member side here too, and who they are, because I think they're special and they have special training that they received, some of which is helping them in their job here. And I'm talking about health center and wellness.
Great. Thank you for that. All right, we are just after 2:30. Any closing questions that anyone is itching to ask before we close? All right, well, thank you all for joining, and I hope everyone has an enjoyable afternoon. Take care.
Okay.
Thank you.